Hello, good evening. It's 5:30. Welcome to this COVID-19 vaccination RC expert session specifically for students. You're very welcome this evening. Our aim this evening is to provide you with the most up-to-date guidance about the COVID-19 vaccination and also to answer any questions you may have about receiving the vaccination as you return to college or university across Suffolk and North East Essex. This is the latest in a series of our RC expert events that we're running. As with previous events, we're going to run it in two parts. For the first 15 minutes, we're going to be holding a discussion with our panel of experts to provide you with information and answers to the most commonly asked questions. And these relate to things like current guidelines, how the vaccination has been developed, current protocol on booking your vaccination, and also how to join a GP practice if you're new to the patch. We know that many of our students will be new to the area, so some information about that as well. We're then going to follow this up with an opportunity for you to ask any questions that you may have as well. And for that, I'd ask you to use the chat box in the right-hand side of the page to pose your questions. You may wish to wait until you've heard our initial discussion first, but please note we won't be able to answer personal questions or specific questions in this webinar. But if you have an individual question relating to your own circumstance, then please speak directly to your GP to discuss this. So my name's Simon. I'm Head of Communications for the three CCGs across Suffolk and North East Essex. I'm going to introduce you now to our panel, and starting with Dr. Mark Shenton. Mark.
Hello everyone, my name is Mark Shenton and I'm a GP in Suffolk in Stonewall Coast.
Lisa.
Hi everyone, I'm Lisa Nobes and I am one of the chief nurses in Suffolk and North East Essex.
Stuart.
Hello, my name is Stuart Henty. I work at the University of Essex and I'm the vaccination and testing lead for our Loughton, Colchester and Southend campuses.
Carolyn.
Hello, I'm Dr. Carolyn Richardson. I'm a GP partner at the University of Essex looking after students in Colchester.
Fatima.
Hi, I'm Fatima. I'm a medical doctor. I graduated from the University of Cambridge, where I also had a PhD in medical science, and I've been working with Public Health Suffolk on projects like the COVID vaccination and outbreak management.
And Danny.
My name is Danny Scholl. I'm a consultant in public health working at Essex County Council.
Thank you to our panel there. So the timing of this event tonight for students is no coincidence. We are purposely holding this forum now, as we know, as I said earlier, that many students are in the process of starting the academic year, and for many students it will be their first time away from home and enjoying Freshers Week. So as a local health and care system, we're making huge strides in the continued rollout of the vaccination. And before we talk in a little bit more detail about the vaccination, Fatima, can you start the ball rolling, please, by giving us a little bit of an overview about the current state of affairs regarding the COVID-19 in the UK and the general trends we are seeing in respect to the spread of COVID across the UK and indeed across Suffolk and North East Essex, if that's possible, please. Fatima.
Sure. So this whole world has been upside down in the past 18 months, but considering we rolled out a vaccine in less than a year, almost 9 out of 10 adults in Suffolk and across the UK have had their first dose of a vaccination, and more than 8 out of 10 are fully vaccinated. And it's because of this incredible drive that hospitalisation is generally lower, deaths are generally lower, and we've come a long way in how we're tackling the virus. But the virus is still very much around. In the past week, there have been about 250,000 positive cases of COVID across the UK. There are almost 7,000 people in hospital as we speak with COVID, of whom 850 are in intensive care beds. And unfortunately, in the last week, almost 1,000 people have died within 28 days of a positive COVID test. So although we've made great strides, there's still some way to come, and we still need to be aware of the vaccine that's around. And the best defense is having the vaccination. If you look at the young age group, so 18 to 25-year-olds specifically, someone who is unvaccinated is 6.5 times more likely to be admitted to hospital with COVID than someone who is fully vaccinated. So even though generally your risk is lower compared to kind of your nan or your grandfather, younger people can get affected with COVID. They can get seriously unwell, and it can also affect their studies. So vaccination is still key. And actually what we've seen recently in Suffolk itself is an increase in COVID positive cases, particularly in the younger age groups, so school-age children, because kids have gone back to school, they're spreading it amongst themselves, and currently they're unvaccinated. So when the rest of the population is vaccinated, it's more likely to spread among the unvaccinated groups. So we encourage you to go out and get jabbed. Only about half of 16 and 17-year-olds in Suffolk and the UK have had their first dose. Just almost 2/3 of 18 to 25-year-olds. So as a population, you can do a lot in your role in this pandemic.
Thanks, Fatima. Let's turn now to Lisa. Some stark figures there that Fatima gave us just then. Can you tell us why it is so important for students in particular to get vaccinated at this time, and the role that they have in protecting vulnerable people in society? Lisa?
Yeah, sure. Thank you. So Fatima gave a brilliant answer to that question already, I think, but I'll just give a little bit more of an answer. So COVID's going to be around for a long time, if not forever, I would imagine my public health colleagues would say. So most people will develop immunity either through vaccination or through developing COVID. So there's a bit of a, if you choose not to get vaccinated, you play a bit of a game of Russian roulette around actually contracting the illness itself. I think for young people, yes, we do see some young people who develop severe illness, but it's quite low numbers. The bigger risk for young people is around long COVID. So there's been studies done that's shown that up to 15 weeks later, 1 in 7 young people who had COVID still had symptoms of headaches and tiredness. Nobody wants to have that, particularly if you've just started a new course, you're at university. Nobody wants to still have a headache and feel tired 15 weeks after developing an illness. And actually we know that long COVID can be even more debilitating than headaches and tiredness, and other studies have shown that a much higher percentage than that, actually around 50% of people, young people, still have symptoms of COVID weeks after actually developing the illness. So there is the risk of serious illness, there is the higher risk of long COVID, but also we need to reduce the transmission. Fatima gave great numbers of adults that have had the vaccine, but we really need to reduce the transmission. So we all have a role to play in that, and we would really urge you to be part of that. Get vaccinated, help us to reduce the transmission, and we'll all be just that little bit safer.
Particularly important, Lisa, if students have relatives or friends or family members who are vulnerable or clinically vulnerable as well, isn't it? What would your, again, is there anything you'd like to add around that as well, please?
Yeah, sure. So people who are vulnerable, we know, are at high risk of serious illness. Hopefully they will have been doubly vaccinated, so that improves their risk. But if you develop COVID, you can very, very easily transmit it to the people that you live with, the people that you come into contact with, and they may be at higher risk of being seriously ill.
Thanks, Lisa. Now, at the last event we held, the last RC Expert event that we held about vaccines and concerns associated with pregnancy, fertility and breastfeeding, we heard from so many people who were worried about the unknown effects of the vaccination. Here's a question to Danny now, if I can bring Danny in at this time, please. What assurances can we give students about the safety of the vaccination?
Thank you very much, Simon. I'll go first through those things that you've mentioned, the pregnancy, fertility and breastfeeding, because they're things that we've had lots of questions on in the past, and then I'll go to generally how we can be assured of the safety of the vaccine. So there's this strange, going to pregnancy first of all, we now routinely advise pregnant women to be vaccinated, even if they have no other risk, to be vaccinated against COVID, because we know that the outcomes are better for the mother and the child if they're vaccinated. And this has come predominantly from studies initially in America, where they vaccinated a large proportion of pregnant women and monitored them for the safety of the vaccine, and found that it was completely safe. There was no theoretical reason why it wouldn't be safe, but there's nothing better than real world evidence. So that initially came over from the States, and that was months and months ago, and the guidance has changed in the UK, and we've been monitoring the effect in pregnant women and haven't had any alarms or reasons to doubt its safety in pregnancy. So it's entirely safe in pregnancy, whereas getting COVID during pregnancy is not. So we'd recommend the vaccination in somebody who was pregnant or planning to be pregnant. And then there was this strange idea that it was put around that there might be some interaction with fertility, with absolutely no evidence. There's no theoretical reason that is credible as to why a vaccination against COVID should interrupt fertility. But once the message has got around, it's very difficult to control. The initial studies that were done when they were first of all looking at the safety of the vaccination, they compared groups who were vaccinated and unvaccinated. They asked initially that women wouldn't get pregnant whilst they were doing the studies, but humans being humans, a number of people fell pregnant, and more people fell pregnant actually in the treatment arm, those who had vaccination, than those who didn't, just by chance. So that's an early indication that there's no problems with fertility. How do we know that there's no long-term problems with fertility? Well, until we've got the data, then we won't have the real world evidence to show that, but there's no reason to suspect that there would be a problem. And the problems that we see associated with vaccines tend to be within the first weeks, maybe a couple of months after the vaccine. So we would have expected to see some signal of a problem had there been any problem. I just quickly mention that COVID-19 is a multi-system disorder. So although we don't know of a association between COVID-19 and fertility, the actual disease itself and fertility, it would be much more credible that there would be a connection there in the long term. So that's another reason, if you're worried about fertility, to promote getting the vaccine. Breastfeeding, there is no, there's never been a suggestion that there was any problems with breastfeeding. The vaccination, it isn't expressed in breast milk, so it's entirely safe to breastfeed before and after being vaccinated with COVID-19. And the Royal College of Obstetrics and Gynecology has come out very strongly on that. Then if I can come to the general, how do we know that this vaccine is safe? That we have in this country the yellow card system, where any side effect that is associated in time with either a drug or a vaccine can be notified. So any adverse effect that happens following a vaccination, and that has led to very close monitoring of this vaccine, as with all drugs, and that's been studied. That's allowed us to find the very, very rare side effects that people would have heard of, where they have a particular type of clot that can lead to a clot in the brain. Incredibly rare, but is picked up because of the surveillance that is done on vaccines to pick up adverse effects. We've got that in this country. That's replicated in all European countries, and in America they have their own system of monitoring. So and millions and millions and millions of people have been vaccinated. So had there been any safety worries, then we would know about it now. If I can just say one, hogging the chat, so I'll only say one further thing, which is often people say, well, how can you know? We've had this vaccination now around for a little less than a year. How can you know the long-term consequences of this? And that is true. Until we get to 10 years on, we can't say that there is no long-term side effect. However, as I mentioned before, we generally see side effects from vaccinations much quicker in days, weeks or months after the vaccine has been given, so it's unlikely. And then you have to look at the disease itself, the COVID-19, the fact that actually we do know that that affects multiple systems within the body. We do know that there is this long COVID, which for most people it's a nasty thing and is over after 3, 4 or 5 months, but they recover. But some people have it for a prolonged period of time, and it's much more likely that there will be prolonged effects from the wild infection than from a vaccination. So I think we can be pretty sure, well, as sure as we can be of anything, that this vaccine is a safe vaccine.
Thank you very much indeed, Danny. Really detailed answer there. Really grateful for that. Danny mentioned there a bit about long COVID in his answer. I think we'll come on to long COVID shortly, because that's an area which we know has been asked by many people, many young people especially, and concerns about that. But before we do, let's go to Dr. Carolyn Richardson, who's a GP in Colchester at the nearby University of Essex. And don't forget, if you have still got a question, please do post it in the chat. We have got 1 or 2 that have been posted already. We'll come on to those in just a second. So the question to Dr. Richardson, please. How can students access their second dose if they are in a different location to where they had their first dose?
Thank you, Simon. So this is quite straightforward. If our students have moved from somewhere else in England and they're already registered with a GP for NHS care in England, so they can then access their vaccine appointment through the National Booking Service. It is a little more difficult if you've come from Wales or Scotland or Northern Ireland because of differences in the NHS provision of services. So really it's all about getting the English NHS number to allow access to vaccination, and you can do this by registering with a GP in England, and then you'll be able to either book the vaccine through the National Booking Service or through your GP surgery.
Thank you, Carolyn. That's really helpful. Another question, if I may. What do students do, Carolyn, if they are registered with a GP in their hometown, but not where they study, or vice versa? What would your advice be to them? Okay, so yeah, again, this is quite straightforward, and this will probably apply to a lot of students that we're welcoming to Suffolk and Essex this month. So if the student's age over 18 and registered with a GP practice, they book their appointment through the National Booking Service at a convenient location, and there are lots and lots of vaccine sites popping up over North East Essex or across Essex, the whole of Essex and Suffolk. So there's a lot of choice, there's a lot of different locations. It's really all about finding the most convenient location and booking the vaccine there. So again, you know, the first and second doses can either be through the GP or through the National Booking Service, and they don't have to be at the same location. You can have your first vaccine in one place and the second vaccine elsewhere. And it's all the data is entered on a central system and linked up with GP surgeries for notification. Thank you very much indeed. I'm going to bring Dr. Mark Shenton in very shortly, and also Stuart Henty from the University of Essex. First of all, let's go to a question from our attendees. The question is from Katrina. Can you please explain why those 16 to 17-year-olds only have 1 jab as opposed to 2? Question there from Katrina. Can you please explain why those 16 to 17-year-olds only have 1 jab as opposed to 2? Who might be able to answer that one, please? Can I go to Lisa?
I'm happy to start, and then Fatima can fill in any gaps in my knowledge. But I believe at the moment the guidance is for 1 jab, but we await further guidance to see if a second jab may well be required. But at the moment the only guidance we have is to give 1 jab, but we are potentially expecting to give second jabs later on.
Thanks, Lisa. Anything else to add at all from any of our panel members? Fatima, Mark?
Yes, so essentially it's all a risk benefit analysis. As we explained, generally speaking, your risk of COVID is not as great if you're younger, although it still exists. So for the most of the population, we only give 1 jab because that will still give some protection. It's worth saying that 12 to 18-year-olds are eligible for up to 3 jabs, depending on their background health condition. So as a population as a whole, 1 jab gives you some protection. And if the government gets more evidence, they might decide to give a second dose, and it's okay if it might be a few months apart. But there will be sections of young teenagers who will have 2 or even 3 jabs because the evidence shows that that's what's best for them. So it's all about risk-benefit analysis.
Thanks, Fatima. Let's go to Mark now, and please do keep your questions coming in. We'll get to those as soon as we go. Dr. Mark Shenton now. Anyone over the age of 18 in the UK is eligible for the COVID-19 vaccination for free, regardless of their nationality or their immigration status. Can you tell us whether international students need to be registered with a GP to get a vaccination?
Thank you, Simon. The simple answer is no, they don't. And they can get a vaccination by attending one of the walk-in vaccination centres. And if you want to find out where your local walk-in vaccination centre is, you can visit the Suffolk and North East Essex COVID vaccination website, and we'll post that website link for you and find where it is.
Thank you very much, Mark. And just staying with that particular theme around an international student, how do they actually get a vaccine if they're not registered with a GP and they don't have an NHS number?
So, as we said, they can attend a walk-in, but we would recommend them registering with a local GP practice, because there are lots of additional benefits of being registered with their primary care providers for much more than just a vaccination. And you can find your nearest practice on the nhs.uk website, and that will help guide you to where your most convenient local practice is. And by registering, you will be able to then get an NHS number.
Thanks, Mark. Can I ask a question about long COVID, because long COVID has been in the news quite often over the past 18 months or so. I think it would be worth explaining what long COVID actually is and what provision locally is there available for people that do experience long COVID. Who would be able to answer that one, please? Perhaps I could go to Mark.
Thank you, Simon. So long COVID is where symptoms persist for more than about 6 weeks. And the common symptoms that may be persistent are breathlessness and fatigue. And a common symptom, again, is about brain fog is the description. It's a way of describing how it feels intellectually to be subdued by the virus and the impact that it has. There are many other symptoms that are associated with long COVID, probably over 50, but those are the common ones that we see. And in terms of what assistance is available, you can have a referral to a long COVID service, and you don't have to have had a positive COVID test to be referred. There's perhaps a misconception out there that you need to have had a positive COVID test, but that's not the case. And GPs can refer you with suspected long COVID to a clinic where they will be able to work with you on how to manage those symptoms, with the expectation that the vast majority of people will get better with time.
Thanks very much indeed, Mark. Details there about long COVID. There is some more information about long COVID on our website, snevaccine.org.uk. And my colleagues Jared and Sarah have posted the links in the chat to the National Booking Service and also to the local walk-in centres across Suffolk and North East Essex for you to look at there as well. Let's now turn to Stuart Hentley from the University of Essex, who's joined us this evening. Let's find out how universities and colleges are supporting their students. Obviously, this is a Suffolk and North East Essex wide event. Stuart, what support is available to students in relation to getting a vaccination, and how is the education sector working with the NHS to ensure easy access to the provision of the vaccination? Stuart.
Thank you, Simon. So we are working with the local vaccination services, such as Suffolk and North East Essex Vaccination Service, to offer vaccinations on our campuses. We have Colchester, Loughton and Southend campuses, and on each of them we're working with the local service to offer campus clinics, so to make them as accessible to students as we possibly can. We're looking to also inform students and provide them information so that they can make informed decisions, and we're doing that through working with your team today, Simon, to communicate this event to our students. We also have a COVID-19 inbox with Test and Trace, a local Test and Trace team that monitor that 7 days a week to answer any queries regarding the vaccine. And we have that really close working with Suffolk, North East Essex, where we can really come to them with any of the questions that students are raising, and obviously get answers when it's a clinical question that perhaps we couldn't answer. We're also communicating it through our testing centres that we have on campus, and we've developed a video, so that will hopefully release soon, just showing and trying to dispel any myths that we might have around surrounding the vaccine. Alongside that, we have on our website for our student directory a vaccination information page, and again we're linking in with any walk-in clinics that are available locally. So if you don't wish to come to a clinic, or you can't make a clinic that's on campus, we're also directing students to how they can book any clinic that's available locally. Finally, we've recently developed a vaccination history form, and that's to not only book onto the campus clinics, but also to let us know, share with us any questions and queries they have about the vaccination course that they've undertaken so far.
Thanks, Stuart. Sounds like a lot's going on there. I suppose the other question really, if you were a student and you did or were to contract COVID and had to self-isolate, what type of support is there within the university sector or the college sector to those students if they did have to self-isolate, and what impact would that have on their studies?
Well, the university is now really geared and moving towards a dual offer of education. So I think any student that had to self-isolate, that perhaps was concerned about missing lectures or missing lessons, with the dual offer we can now put in place, students can, even when isolating, still access the learning that they need. Obviously, practical elements of their course they may not be able to reach on that during that period, but certainly there are other mechanisms to getting onto your lessons and continuing your learning. With regards to support, we in our university we have in place our own university test and trace team and a student support service that are working together. And if a student did find that they were COVID positive, they will be in contact to to offer not just to find out more about the case and to track and trace, but also to offer support such as food, medicine, advice, even laundry, and looking at any mental health support that you might have during that time. And it's as we said before, 7 days a week, so you can always come back to that team and we can put in place a range of support for a student and their needs. One of the key things we've looked at this year is working with occupational health at the university and with student support is reducing any stigma that perhaps students in shared accommodation that have had to isolate have had, and working with students to understand that having to isolate due to COVID is a very normal thing that can happen, and it's okay, and it will have minimal impact on their studies and on their lives.
Thank you, Stuart. That's good to know. We have had another question that's come in now. The question is, what are some of the names of services helping young people recover from long COVID, and how is long COVID treated? Perhaps I could ask one of our GPs, Mark or Carolyn, if possible, please.
We'd very much like to know if our young adults or any of our patients, or older children, in fact, some of those may be affected by long COVID too. So please let your GP know. We know who has had COVID, we've had test results, we've had consultations for patients who are symptomatic, but what we don't know is if people are struggling at home many weeks after their initial COVID infection and have still got symptoms. So please do contact your GP. We're very happy to find out more about your symptoms and offer you further advice. We do have long COVID clinics we can refer patients to if they meet criteria. We've got quite a long questionnaire to complete with patients before we can refer onwards. And it's really important to exclude other illnesses and not assume everything as far as residual symptoms are concerned is actually related to COVID. We don't want to miss anything else, just assuming because someone's had COVID, their symptoms are due to that. We also direct our patients to a national source of support, which is Your COVID Recovery. That's an excellent website with step-by-step guidance on really, I guess, what to expect, what sort of duration to expect symptoms to last for, how to help yourself through a phased recovery, and where to ask for further help if you need that.
Thank you, Carolyn. Is there anything else at all from any other panel member who would like to add any additional information to that at all? No, I think we are finished. Well, we've got another question that's coming. Jared has kindly put a link to a website which has more information about your COVID recovery. So the website is www.yourcovidrecovery.nhs.uk. There's more information about that there. So that concludes this evening's RC Expert event for students, unless any other panel member would like to add anything as we close. Danny.
Could I just, I'm sorry to come in right to the at the close, but there's just something I wanted to make clear. I didn't want to oversell the vaccine, and there was something I think there might have been a little bit of confusion. So if you have the vaccine, it's still possible to get the COVID infection. And some people get confused about this because they think, well, I've had the vaccine, therefore I'm protected, therefore I can't get it. And what it does is it reduces the risk, dramatically reduces the risk of you getting infected. It even further reduces the risk of you getting a serious outcome from an infection if you are infected. So you're less likely to go to hospital or to lose your life to COVID, and it reduces your chances of getting the long COVID. So it works in all of those different domains, but it is a reduction in the risk. It doesn't completely eliminate the risk. So just because it's so good, this vaccine, there's no need to oversell it, and I didn't want anybody to have that misconception.
Thank you, Danny, for adding that clarity. OK, it's 6 o'clock. That now brings us to the end of our RC Expert event. Thank you very much indeed for joining us. Thanks to our panel. Thanks to Mark, Carolyn, Fatima, Lisa, Danny and Stuart, and also to Sarah and Jared on the controls as well. A recording of this will be available and uploaded onto our SNE Vaccine website. The address of that is www.snevaccine, that's SNEE vaccine.org.uk. Thank you very much. We hope you enjoyed it. Hope you found it useful. Bye-bye.